Hi, I'm Dr. Whitcomb, and thank you for joining me. Today, I'd like to talk about a couple side benefits from our work with fibromyalgia, and that includes trigeminal neuralgia and complex regional pain syndrome, which is also known as RSD. Um, really excited about our work. I'm happy to be here and share this with you. What we're going to do today is explain how these things can possibly be affected by our work, how they are affected, and and in addition to that, how we get there and some of the basics around it. First of all, fibromyalgia, I think, is kind of a misnomer. It's really a lot of the people with fibromyalgia have scar tissue in their muscles, and so there's where your fibro comes from. That's actually fibrous deposits inside of the muscles, and which is scar tissue. And so when you use those muscles, they hurt, or if somebody touches those muscles, they hurt. Oftentimes, the worst areas are in your upper trapezius muscles, in your upper shoulders, and into your neck. We many times will have our patients have some deep tissue massage while they're here to help break up some of that scar tissue. So when they go home, that they can function better with a little less pain, because if we don't do that, those areas stay painful to the touch, but not near as much as they are when you have fibromyalgia. Now, first of all, I'd like to tell you that fibromyalgia magnifies pain. So if you have a certain level of pain when you stub your toe, it could be 10 times that much when you have fibromyalgia. Oftentimes people will say, it doesn't hurt that much. Why are you acting like this? Because you just stubbed your toe. It's not a big deal. It is a big deal, and it hurts much worse. If you can imagine, having a baby would hurt much worse. And even with sexual intercourse, that can oftentimes be quite painful for fibromyalgia patients also. So the name itself is a misnomer. I actually would lean towards a meningeal compression or upper cervical spinal stenosis that's created by um, physical problems, usually after a car accident or a surgery or something like that. For many years, the fibromyalgia patients were our typical hypochondriacs. So they go to the doctor complaining all of this pain, and they were considered complainers, and they stayed home and they didn't want to work, and so people looked down on them and they were called hypochondriacs. But in reality, it was the doctors who were at fault, not being able to find out exactly what was causing their pain. They used to institutionalize fibromyalgia patients. 4% of women, 1.5% of men. If you really take a little better look at this, I think those numbers could be about twice that. So it's really at epidemic proportions. This takes away from the patient's ability to fight, because the patients themselves are actually feeling so weakened and so exhausted from not sleeping and from getting poor nutrition, that many times they just don't have the ability to fight back. It becomes a real severe problem. And so they lose their enthusiasm for life, and sometimes even their desire to continue living. Of course, it affects family members greatly. Of course, it would. Some of the symptoms of fibromyalgia are nervousness, irritability, fatigue, depression, syndrome, foggy mindedness, anxiety, and some of the overwhelming symptoms of fibromyalgia are the fatigue and the depression and the pain. The pain can be, from a localized area that doesn't affect too much, or it could be a large area that would affect the entire body. And so this is what has confused doctors for so many years, is because when it affects a large area, our books are, teach us that that patient is hysterical and that really shouldn't be affecting that big of an area. But it does affect that large of an area. So explain to you how that works is that the coupling of your brain and your spinal cord called the meninges. All the nerves from the brain and spinal cord have to go to the meninges. I cooked a steak. I got too many onions going. So as those nerves go through the meninges, they innervate the entire body, including the organs, almost all of the organs. A few are innervated by side pathways, but mainly this is innervated through the brain and spinal cord, through the meninges. And when you move the meninges from its normal position, it pulls on the nerves. When you pull on a nerve, it causes it to fire. If you hit your crazy bone, your ulnar nerve, you'll feel it down in your fingers. There's nothing happening in your fingers, but that's where you feel it. It's actually what's happened is it happened here, and you created a accident potential which caused the nerve to fire, and now you feel it in your fingers. Your brain registers as it was in your fingers, but it was really from here. When you pull on those nerves, it causes them to fire, and you have the sensation that wherever those nerves go is having a problem. For instance, if you're pulling the brachial plexus, it'll go down into your hands. It can affect one or two fingers. It can affect the entire arm. It can affect the entire hand. In our neurology book, it teaches us that a patient comes in that has an entire hand pain or numbness is hysterical. So you can't really blame the doctors for making those type of diagnoses because that is what's really happening in their mind. But the truth of it is that they just don't understand that the meninges can create this problem. And one of my first patients, I took my MRI over to the radiologist at the hospital, and I said, hey, take a look at this. I think that we have a problem here with the meninges. What do you think? He goes, I have no idea. We have no training in this. He said, we've never even looked at this before. So this type of a finding is huge for fibromyalgia patients because it allows us to be able to have a really good idea of what is causing the pain and how to get rid of it. Before I figured out that I could actually test for this condition, I developed this test where I can move the structures off of the meninges, and when I do, the pain gets better. So if that's truly what's causing your problem, when I take the pressure off of those nerves, the pain gets better, and it gets better like right away, usually 5 to 10 minutes. And most patients will have a 50 to 100% symptom reduction if that's what's causing it. If they don't have any reduction at all, we probably won't treat you unless we have some other reason to believe we should, but mostly we don't treat patients who don't test because they don't normally get well. Before we had the test, we didn't have any way of determining and whether or not they were even a candidate. And of course, you can see as a doctor who's helping people with fibromyalgia, this could be a real problem. And it was a problem. So now it makes it so much easier. We test. We never charge for the test. You come in for the test. There's no charge for the test. If you test well, you're going to be so happy that you're going to be glad to undergo treatment because like instantaneously the first day, I've seen people get out of wheelchairs. I've seen people get their sight back while I was testing them. I've seen people get their speech back. I mean, it's actually an amazing thing, but it's not a miracle. It's just strictly mechanical. So our techniques we used to do some pretty heavy adjusting. We found that some real light trigger point and pressure work actually works better. And so we're doing that kind of procedures today. Really happy to see that working well because it's easier for the patients. Takes a little longer for me, but it's easier for the patients. And it gives me a little more time I can spend with my patients, which is what I really love to do anyway. So we test, it works, we know we can help, and then we move into a whole nother level. Now, let me tell you a little bit about the treatment. Now, if I can back up for just a second, when you pull on the meninges, it depends on what type of movement, but some of the movement will create pain in the face. It'll create teeth pain, trigeminal neuralgia pain. It'll pull on the trigeminal nerve, which creates this horrible pain in your face. It can create eye pain. It can create, if it's bad enough, it can pull in the optic nerves and cause you to lose your vision. I've seen a couple of those, and literally they got their vision back during the test. We've got a video here you can watch. It's on our channel of a woman who actually gets her speech back during the testing. And that is really a wonderful, miraculous thing. She can pull her leg up again, which she couldn't. Her pain disappeared. And of course, that was a very emotional moment for everybody. So when we start the treatment, whether it's causing trigeminal, whether it's causing, it's pulling on nerves that might cause an injured area like a knee to cycle pain. I don't have all the answers for exactly how that works, but I know that a person can come in and have a surgery on a knee and then go out and have that knee be worse when the doctor did a great job. And so the doctor gets the blame for it. But the truth of it is the body is cycling pain because they had a fibromyalgia experience before they started, or the surgery itself, because of what happened to the neck during surgery, actually caused this. So this cycling of pain with RSD will normally stop when we do the testing. And it doesn't mean it stays gone. Of course, the testing doesn't cure everything in one treatment, but at least it lets us know that when we treat, that we should be able to get this under control. I have lots of studies we did in our office. You can look also here on the channel. I have copies of studies. I got a 200-page study. That's the result. Ones we did on fibromyalgia patients higher, just took the fibromyalgia symptoms, and they were like 85% of our if you are having convulsions, you need the convulsions stop relatively quickly. Sometimes we have some wild things happen. We adjust patients and they pass out. I had one woman, she passed out every time I adjust her, and then she would be out for about 15 seconds. She'd wake up and go, "Wow, I feel so good." Anyway, it was pretty interesting. Anyway, I should say at the least. And then typically by 4 or 5 weeks, the sympathetic nervous system turns off. Sympathetic nervous system has been running because you're pulling on too many nerves. That's why you don't sleep at night. And that's why you don't digest food and you've got the irritable bowel syndrome, because you're in sympathetic mode all the time. So when that turns off, we have this wonderful thing. I have patients come in and they'll go, "Doc, I don't feel so good." And I go, "What's wrong?" They go, "I'm so tired." And I go, "Are you sleeping?" And they go, "Well, yeah, I slept like 14 hours last night." I said, "Your sympathetic just turned off." I said, "Give it a few days. You're going to have more energy than you had in a long time. You're just suffering from sleep deprivation." So within a relatively short period of time, they're sleeping all night long. The irritable bowel syndrome stops. They start eating. They start digesting food better, assimilating nutrients better. They get this newfound energy in the second month, and they usually become the parents, and they start taking care of my other fibromyalgia patients and taking them on hikes and going places and going shopping. And so we end up with the people in the second month taking care of the people in the first month. And it's like a big family, and everybody's there every day anyway, because we're doing multiple treatments a day. In most cases, not all cases, the ones who are worse will need that. But anyway, it's a big family. Everybody takes care of each other and looks after each other. It's a really good, positive attitude. And I just absolutely love my work. So let's see here. What haven't I? You know what? Once in a while, I have patients that have rashes. You get pretty bad rashes too, but it's seldom. But once in a while, we'll see that kind of thing. Sometimes your whole system goes off. Almost always, your hormones are off. Thyroid's not working right. You're not producing testosterone and estrogen, and those things go down. All of those things combined make it confusing for the medical profession, because they look at it and the endocrinologist says, "Well, all their hormones are all off," and they are in almost every patient. And the gastro guy says, "Well, you've got irritable bowel syndrome. No wonder you're not feeling well." And and the neurologist says, "Well, your nervous system isn't working right and it's hyperactive." And So, and each one of them are correct, but their profession after 20 years now, 20 years of us helping people, that it seems like it just isn't going as fast as it should. And I'm going to ask you to please join in with me and reach out. Let other people know about what we're doing. Get them. I'm going to be doing these videos, different videos and live videos consistently now, and have people tune in. And we need to get the word out. We need to get the word out because it's taking way too long and way too slow. And the medical profession has not helped us at all. Matter of fact, we had a research project that was going on. It looks like they stomped on. Anyway, so we're doing our best. And there's a lot of good things happening in the background right now. So help me. I need all the help I can in getting the word out. Most of the people they have fibromyalgia because they had a trauma. Car accidents are the most common, but falls, blows to the head. Surgery because of having your neck in a funny position for a long period of time. You know, I'm not against surgeons and I'm not against anesthesiologists. These people love their work and they're doing the best they can. It's just that they're not aware of this, and oftentimes it can create problems. So after your treatment, if you go home, you need to have a surgery, have the anesthesiologist call me, or at least ask them to pick your head up every 10, 15 minutes and move it around. It'll be very helpful because it can cause a huge flare-up after going home. I've seen people go through a divorce and get fibromyalgia, and just the stress of it all. I don't quite understand how that works, but I've seen it. Genetic predispositions, sometimes the tolerances are just a little small up there, and the slightest little injury can create fibromyalgia. Light cases, these people work, but they don't feel good. They don't sleep well. Maybe they're a little grouchy because they have a hard time dealing with life and all of their symptoms. Shoulders are tight. They might ask you to rub their shoulders. Anyway, that's a light case. Most of the time, fibromyalgia is progressive, and it almost always progresses into a more severe case. I've seen quite a few children with it. It's not as common as with adults, but usually it's after a trauma. I had the sweetest girl come in. She had spent the last, I think, year and a half, her parents rotated holding her all night while she screamed and cried. And she was thrown from a Shetland pony, landed on her head, and after that had really bad fibromyalgia in the, where her mom worked at the hospital, but they couldn't figure out what was going on with it. And anyway, she came in and it was a tough case because every time she started feeling better, she'd want to start running and jumping and tumbling. And anyway, but we got her back on her feet and she's doing well today. Once in a while, it'll create a tug on half on one side of the meninges and create one-sided fibromyalgia. So you'll say, well, my right arm, my right leg, everything on the right side hurts, or left side. Very interesting. Those are usually a little easier to deal with. The techniques we use are basically painless, a little uncomfortable sometimes, but not bad at all. So our goal in all this is to release the meninges so that it releases the nerves and everything just starts functioning properly again. At that time, your hormones should go back to normal. I have a lot of patients that called me up and said, hey, I go back to my doctor, my thyroid's working again, or my blood pressure is not high anymore. Sympathetic nervous system running can create high blood pressure. That's one of the side effects of it. So, some of the complications. Spinal stenosis can be a complicating thing that interferes with my ability to help. And sometimes spinal stenosis in the upper cervical spine due to trauma and maybe osteophyte formation, bone spurs or something, can really create a false reading for us. But if it is that, it doesn't respond to the test anyway. So we have a heads up on it before we go any further. Your Arnold-Chiari malformation, which is a kind of herniation of the cerebellum into the upper neck, that can create some problems. Most of those we've had good results with. It can be a little confusing, and sometimes I don't understand my work completely. I got the basics down, but anyway, people want to know how long it's going to take under treatment. Treatment runs about, well, a lot of it depends on the test. If I test you and by the time you walk out the front door, you're sick again, it's probably going to take a couple months to get you back on your feet. Might even take longer. if I test you and and it's gone for 2 weeks, I'm not going to take very much treatment to get you well. I had the most remarkable thing I seen with the test as far as it lasting was a patient that I went up and helped a doctor in Bakersfield at a talk he gave, and we tested a patient who was in a wheelchair, and he just got up and walked, and he'd been in a wheelchair for years. And then a couple of weeks later, the doctor was telling me he comes into the office and he's pushing his wheelchair, he's walking. And the doctor says, well, how are you doing? He says, I'm fine. I have no pain. I can walk. I can do everything again just after the test. And so the doctor says, well, why are you pushing the wheelchair there? And he said, well, I'm afraid if it comes back, I won't be able to walk and get out. So I just bring my wheelchair with me everywhere. Well, it turns out that he stayed stable. He never had another problem. He moved to Washington, started working again, and was happy. And another funny one is I tested a woman, I think it was in Minnesota, at one of the talks I gave. And then she showed up in, I think, a couple months later in Nashville at another talk I gave. And I said, well, she said, I'm back. I said, I'm so glad to see you. What are you doing way down here? She said, well, last time you tested me, it lasted for 2 weeks. And she said, I don't really have the money for treatment, so I'm just coming back for another testing. If you don't mind, I'd love to have another 2 weeks of pain-free. And I said, well, of course. And so we tested her again and helped her. But so you see some really remarkable things from the test. And typically what I would do is speak in different cities, twice a month. And talk about it like I do now, and then the testing afterwards. And then the test would be really concentrated. People did really amazing job. He brought a bus full of patients, and we had so much fun that day. I had 5 doctors helping me test. I just want to beg spouses to take this really seriously. You just don't blow it off like your husband or your wife is some kind of weirdo complainer, because they get stuck. They go to the doctor and have to find the doctor. They want pain medication, and that's why they're there. They're just complaining and making up a story, because the doctors get a lot of that. So you can't really blame the doctor. Yeah, but the patient now is going, but I'm really okay, I'm really stable. So they usually find someone who will put them on meds, and the meds are almost always anti-anxiety medications like Xanax, or some type of a sleeping medication, and then heavy medication. I see patients on everything: the Dilaudid, the morphine, and the methadone, and the Oxycontin, and patients who are getting injected every day. It's a really horrible thing. So if you're a spouse, show some sympathy. If you got a friend with fibromyalgia, call them every day. Even if they don't call you back, call them, just tell them you love them, because their friends usually desert them after a while, because they did feel like, they never go out, they don't want to spend any time, they can't stay up long, and oftentimes they just lie in bed for years and just be miserable, and then more severe cases. So I had a few patients that lost weight. They lost a lot of weight. I had one woman, she lost 80 pounds and went home with a size 2. She's been in bed for a long time. And anyway, I think just the nature of the disease sometimes can cause you to swell up with fluids. So when you're done, start a new life, but start it gently. You come in for treatment. When you go home, take a look at your house. It's probably got all the windows closed and it's dark because light hurts your eyes. But when you go home, take good care of yourself and have a little fun. Don't force yourself for 40 hours a week right away. Start with a few hours here and there, maybe one day, and work your way into a gym. You need to have kind of a graduated thing back into your life. If you're a spouse, don't force your sick spouse to go back to work already. Their bodies are well, but their minds are still a little sick. It takes a while to recover from that. So with all that, thank you so much. If you'd like it, that would help the word get out to other people and please tell other people about us. You can share or you can subscribe. Thank you so much. I really appreciate you listening. And anytime you want to call,